Fascinating facts about kidney dialysis. 1. Hemodialysis and peritoneal kidney dialysis have been done since the mid-1940s. 2. The central government pays 80% of all kidney dialysis costs for most patients. 3. Since the 1960s, reconnaissance considers have reliably demonstrated that American kidney dialysis patients don't live as long as those in other countries. The U.S. death rate for dialysis patients is around 23%, double the pace of patients in Western Europe or Japan. 4. As indicated by the National Center for Health Statistics, kidney dialysis endurance rates are as per the following: 1 year 77%, 5 years 28%, 10 years 10%. 5. Around 90% of dialysis patients get hemodialysis, in which the blood is flowed outside the body and cleaned inside a machine before coming back to the patient. 6. Kidneys procedure 18 gallons of blood every hour with an advanced strategy for discharge, ingestion and reassimilation. Before every day's over, they can deliver as much as 7 gallons of pee. What is kidney dialysis? Kidney dialysis is a treatment that does a portion of the things done by sound kidneys. It is required when your own kidneys can never again deal with your body's needs. When is kidney dialysis required? You need kidney dialysis when you create and organize kidney disappointment, as a rule when you lose around 85 to 90% of your kidney work. What does kidney dialysis do? Like solid kidneys, kidney dialysis keeps your body in balance. Kidney dialysis does the accompanying: expels waste, salt and additional water to keep them from working up in the body. Keeps a protected degree of specific synthetic concoctions in your blood, for example, potassium, sodium and bicarbonate. Controls circulatory strain. Is kidney disappointment changeless? Not generally. A few sorts of intense kidney disappointment improve after treatment. Now and again of intense kidney disappointment, kidney dialysis may just be required for a brief span until the kidneys show signs of improvement. In constant or end-organized kidney disappointment, your kidneys don't beat that and you will require kidney dialysis for a mind-blowing remainder. On the off chance that your primary care physician says you are an applicant, you may decide to be put on a hanging tight rundown for another kidney. Where is kidney dialysis done? Kidney dialysis should be possible in a medical clinic, in a kidney dialysis unit that isn't a piece of an emergency clinic, or at home. You and your primary care physician will choose which spot is ideal, in view of your ailment and your desires. Are there various kinds of kidney dialysis? Indeed, there are two kinds of kidney dialysis: hemodialysis and peritoneal kidney dialysis. What is hemodialysis? In hemodialysis, a counterfeit kidney hemodialyzer is utilized to evacuate waste and additional synthetic substances and liquid from your blood. To get your blood into the fake kidney, the specialist needs to make an entrance into your veins. This is finished by minor medical procedure to your arm or leg. Now and then, an entrance is made by joining a corridor to a vein under your skin to make a greater vein called a fistula. Be that as it may, if your veins are not sufficient for a fistula, the specialist may utilize a delicate plastic cylinder to join a course and a vein under your skin. This is known as a unite. Incidentally, an entrance is made by methods for a tight plastic cylinder, called a catheter, which is embedded into a huge vein in your neck. This sort of access might be impermanent, however, is some of the time utilized for long-haul treatment. To what extent do hemodialysis medications last? The time required for your kidney dialysis relies upon how well your kidneys work, how much liquid weight you gain between medications, how much waste you have in your body, how large you are, the kind of counterfeit kidney utilized. Generally, every hemodialysis treatment endures around 4 hours and is completed 3 times each week. A kind of hemodialysis called high-transition dialysis may take less time. You can address your primary care physician to check whether this is a suitable treatment for you. What is peritoneal kidney dialysis and how can it work? In this sort of kidney dialysis, your blood is cleaned inside your body. The specialist will do medical procedure to put a plastic cylinder called a catheter into your belly, midsection, to make an entrance. During the treatment, your stomach territory, called the peritoneal depression, is gradually loaded up with dialysate through the catheter. The blood remains in the supply routes and veins that line your peritoneal pit. Additional liquid and waste items are drawn out of your blood and into the dialysate. There are two significant sorts of peritoneal kidney dialysis. What are the various types of peritoneal kidney dialysis and how would they work? There are a few sorts of peritoneal kidney dialysis, yet two significant ones are continuous ambulatory peritoneal dialysis (CAPD) and continuous cycling peritoneal dialysis (CCPD). Non-stop ambulatory peritoneal dialysis (CAPD) is the main sort of peritoneal dialysis that is managed without machines. You do this without anyone's help, normally 4 or 5 times each day at home and additionally at work. You put a sack of dialysate, around 2 quarts, into your peritoneal cavity through the catheter. The dialysate remains there for around 4 or 5 hours before it is depleted, go into the pack and discarded. This is called a trade. You utilize another sack of dialysate each time you do a trade. While the dialysate is in your peritoneal depression, you can approach your standard exercises at work, at school or at home. Constant cycling peritoneal dialysis (CCPD) as a rule is done at home utilizing a unique machine called a cycler. This is like CAPD. Aside from that, various cycles, trades, happen. Each cycle for the most part keeps going 1.5 hours and trades are done for the duration of the night while you rest. Will kidney dialysis help fix the kidney malady? No. Kidney dialysis does a portion of crafted by solid kidneys, however it doesn't fix your kidney infection. You should have dialysis medicines for as long as you can remember, except if you can get a kidney transplant. Is kidney dialysis awkward? You may have some uneasiness when the needles are placed into your fistula or join, however most patients have no different issues. The kidney dialysis treatment itself is easy. In any case, a few patients may have a drop in their pulse. In the event that this occurs, you may feel debilitated to your stomach, upchuck, have a cerebral pain or issues. With visit medicines, those issues for the most part leave. To what extent has kidney dialysis been accessible? Hemodialysis and peritoneal kidney dialysis have been done since the mid-1940s. Kidney dialysis, as an ordinary treatment, was started in 1960 and is currently a standard treatment all around the globe. CAPD started in 1976. A large number of patients have been helped by these medicines. To what extent would you be able to live on kidney dialysis? We don't yet have the foggiest idea to what extent patients on kidney dialysis will live. We believe that some dialysis patients may live insofar as individuals without kidney disappointment. Click the link in the description for more information.